Good evening. Happy Martin Luther King Day. We are rolling. There we go. Looks good. Jumping right in. Good evening, esteemed viewers, and a heartfelt welcome to our Know Your Pharmacist live stream. I am Dr. Joaquin Acosta, your guide on this enlightening journey where healthcare meets humanity. Tonight, as we honor Martin Luther King Jr.'s enduring legacy, we intertwine his principles of justice and equality with our passion for pharmacy and wellness. In today's world where innovation meets empathy, we stand at the forefront of a healthcare revolution. Our exploration will navigate through the dynamic world of mental health tech, shedding light on how artificial intelligence is redefining care. Excuse me, let me clear my throat here. Anyways, with a blend of warmth and expert insight, we delve into art therapy's transformative power during life transitions, like menopause, bringing solace and creativity to the forefront of healing. As we celebrate Martin Luther King Day, let us reflect on his values of diversity and inclusion. We'll critically examine the current landscape of pharmacy in light of these values, discussing the stark realities and challenges faced by communities and colleagues alike. Together, we will explore the evolving legal frameworks around cannabis, understanding how policy shapes practice. Our community spotlight shines on the unsung heroes of Doñana County, embodying resilience and hope. And for our gentlemen viewers, our Mental Health Minute takes a deep dive into societal pressures you face, breaking stereotypes and fostering a dialogue for well-being. So let's connect, collaborate, and embark on this journey of discovery. With each insight, let's fuel our collective passion for healthcare and our commitment to positive change. Stay engaged, ask questions, and be ready to be captivated as we unfold the tapestry of today's healthcare narrative, inspired by the spirit of Martin Luther King Jr. Thank you for joining us. Your presence enriches the conversation, and together we can continue to make strides in healthcare driven by compassion, expertise, and an unwavering commitment to excellence. Guys, jumping right in here tonight, Martin Luther King Day. Personally, my favorite quote, going through those today. The ultimate measure of a man is not where he stands in a moment of comfort and convenience, but where he stands at times of challenge and controversy. Straight to Love, 1963. This guy had a lot of bangers. He was a very just American, and he advanced our nation in many, many positive ways and left a positive impact on us. And, remembering Dr. Martin Luther King Jr. today, guys, critical discussion I definitely want to have in the pharmacy space here is, reflecting on, his role of diversity and, equality and justice there. Does the pharmacy industry feel like, corporate Walgreens, for instance, reflects the diversity measures that they so claim to say, right? And right, this is where I'm coming at. No, I don't believe everybody does. And, I hope everybody doesn't hate their boss, but when it comes to Walgreens, CVS, Rite Aid, the recent pharmacy walkouts in quarter four of 2023 really created a spotlight as to the issues in the pharmacy industry as a whole, and other healthcare denominations started kind of forming unions in different spaces too. Nurses, even your hospital pharmacies, different sectors of pharmacy industry, started kind of realizing some of the parts of the healthcare system that are broken, to the fact that they are not listened to in the amount that is put out there for pharmacists to have to put on their license in a volume sense, without being able to give any sort of amount of real decent personalized care and have the time to do so, or the staffing or the ability to do that. And you're always working for a number against 15 numbers back, right, from trying to even advance one step forward. And that retail pharmacy industry has been feeling it bad. COVID was a really hard time for, of course, healthcare in general, burden on the system, but really a lot of people obviously really maxed out and went all in the healthcare world. We were given care, you were given vaccines, and those numbers and metrics never slowed down, right? And again, where coming out of it, all the goals do is to consider to go up. They say, okay, we're losing numbers now because we're not getting those vaccines anymore from COVID. Again, they are still out there, still recommended, but I'm doing 4 boosters a year. It's not only thing in the same way it was and at the same volume that it was in terms of a profitable thing. And so every time you dial back on profits, they slash payroll or whatever else it may be 50 times. And these pharmacy staff, pharmacists, pharmacy managers, whatever, store staff, associated technicians, right, end up working at some really odd ratios to the amount of volume that they are having to do and perform work. And whether the system thinks I mean the technological part, like the actual operating system that they design, that they feel like has a lot of fail safes for you to be able to perform a lot of output. Again, it has also really been designed for only one thing in mind, and it doesn't and hasn't been adjusted in those sort of community style systems. Again, and that is where the efficiency and change really should make something a little bit more just. And I think in terms of being a pharmacist, speaking out right against something that's not just, and having the courage to speak out against it, I think embodying Dr. MLK's message there of identifying, yes, this time in the corporate pharmacy industry is definitely odd. It definitely may not match exactly what some of those American values there that they I saw a word for it, king washing, represent and cherry pick as a marketing ploy. So for instance, let me show you kind of an example of something, a post I saw on LinkedIn, and this is from another pharmacist and a group of pharmacists actually. And I'm not going to show it because I don't want to call anybody out by any means, but posting on this, he was saying, "Oh, Walgreens, this is one quote that does not suit you. Please stop." And so it's Walgreens' post from early this morning. Martin Luther King Jr. was a leader whose principles should be a guiding force, not only in our personal lives, but also in what we bring to the workspace. Diversity, inclusion, justice, and equity. We strive to reinforce Dr. King's legacy of service and equality by how we operate, how we treat our team members, patients, and customers, as well as communities in which we champion the health and well-being of those we serve, says Alethea Jackson, Senior Vice President of ESG and the Clinical DEI Officer of Walgreens Boots Alliance. And together we have the power to build a diverse, equitable, and inclusive workforce and culture that guides our actions in delivering better health comes for all, right? So again, this pharmacist, popular post, "Oh, Walgreens, this is one quote that does not suit you. Please stop," right? And again, the commentary on this truly does, I think, draw a rational question as to should you be king washing, right, as a business, things that you may not really value and believe in, right? Something we were dissecting last Friday, guys. Pharmacy deserts. Walgreens is a big part of this. They're closing their stores in Hispanic and African American communities, your low income communities, right? Your underserved communities. They make them even more, and they call them now pharmacy deserts, and they've made it almost impossible for the average Joe to go start their own pharmacy and compete against them in any sort of reasonable way. It can be done, but those numbers have thinned out over time. Pharmacy used to be such a independently ran operation where you'd go to the pharmacist at his own business, right, his own place of business. Of course, things changed as Walgreens really started showing that model in this country, and then the world itself kind of took that for a spin over the last 60 plus years. But looking at now where they're kind of talking about, supporting these things and people calling out, the fact that, are they even supporting diverse, equitable, and inclusive workforce when all your pharmacists are saying, we're overstaffed, underworked, and, this is jeopardizing patient care. This is, putting people at safety risks, and we're asking too much, and we're doing all these things, oddly enough, and we don't, you get pizza for, do the right thing. But again, from somebody who's been in those trenches for over the last 10 plus years, Walmart was a little bit of a better system, and that's why you don't see pharmacists unionizing at Walmart, and at the same time, Walmart has a really good union policy there. But people didn't willingly walk out of those jobs, right? And Walgreens, CVS, Rite Aid, people protested. Kansas City, read all about it. September, October, it was a thing. So it's like Dr. Martin Luther King Jr. Was he, does Walgreens have the herewithal to go ahead and claim those things when you look some of their internal footprints and some of those external footprints of kind of abandoning those neighborhoods, right? And creating a weird healthcare system that is very obviously completely messed up and has created gaps in care. But we're at a technological place where we can manage, right, larger amounts of people with less people and more tech. Sure, Walgreens is trying to get to that point, good for them. But in that meantime, how we've, tried to address is the fact that they're not there yet, and there's voices that are not heard. Pharmacists, pharmacy technicians, patients, they can go and do the cutesy things when they can be in a college town and have a good influence with a college town with a college of pharmacy, right? And you can actually have obviously really good relationships because they can steal all the free help with all the internships and everything like that. And they're always fully loaded, they're fully staffed. But talk about these towns that don't have college of pharmacies, even El Paso, I guess, might have a little bit of a different place, but rural New Mexico, is definitely one of those places that you can see scattered all over affected in terms of not having help there, unless you've had, like the good programs that we had, like that I came from, the NMSU UNM Cooperative Pharmacy Program. Everybody that was selected out of the Southern New Mexico, all those districts and counties, had to go back to their counties to go help, and obviously kind of wanted to. It was part of the vision for the program. All good stuff, and that's why I'm still here doing it. It was something I committed to and embodied from many moons ago. And looking at that, part of what we have to do is still have to have the courage to speak up about the things that have truly kind of plagued our system, that have led to even worse health outcomes. Us not being able to use work at the top of our clinical licenses, at the top of all of that, because it doesn't quite line up to what we need, right? And if you're a pharmacist that's spending all your time on the computer, clicking buttons just to push numbers, and you're not out there able to do patient care, we're at the point where tech might be able to evolve to catch up to pharmacy and be able to do all those back end things so the pharmacist can work and get in front of the patients and do that kind of stuff. Talk to other providers, right? Actually doing clinically relevant things for their job, other than things that probably shouldn't be their job, but again, they get truly just having to cherry pick weird activities to do and at the mercy of the customer. And so it's profits over people, and talking about something is that Walgreens should go out there and claim. I know they've done good things for communities, and that's not to dismiss that they've never done anything, but to go out there and almost kingwash community, somebody who really made a tangible difference in American history, is maybe not something that we want to say Walgreens is, our is something that I support. I don't think that's something that aligns with how those big box pharmacies are treating their communities around them. They're again abandoning communities that do need the care. Pharmacy deserts, look it up. I've been talking about it last Friday. Go check my stuff, but other than that, it's a thing. And so issues right now that are plaguing the American healthcare system, all of a sudden, those communities that sometimes may not be the most profitable in the big machine's eyes are ones that they're willing to abandon. And whether it's rural black communities within Boston, or out in Nebraska, or out in New Mexico, guys, it's everywhere. So Walgreens is there's something, but I'll stop harping on them. They can still turn it around. Still believe in them. I get that I get the mortal enemy thing there, but the crusade of what they've caused. fighting to fix all of that is something that I want to be a part of. I don't need to sit there and tear them down to help clean this mess up and hope that we all catch on to all the same things at the same time eventually, right? We're all the same mission at the end of the day. We should be when it comes to patient care and take care of people and all that. And if you're not, then you're going to get exposed because I still got time and a plan. So that's that, guys. Talking about technology in our tech talk. This one's pretty cool. So Bupa. It's an insurance, but also personalized care on top of insurance, and pretty cool stuff. I'm 2 seconds to fix that. Is there music coming from this website? If so, that's epic. So guys, changing basically not only mental health management, but insurance management. Like today is technically considered Blue Monday on January 15th, 2024. Also supposedly the day, the most depressing day of the year, and also supposedly the day most New Year's resolutions will fail. While the science behind the phenomenon is questionable, it was created as part of an advertising campaign to sell more holidays. It's a day that's worth mentioning as it highlights that mental health is still a serious concern. The WHO, World Health Organization, estimates that there's been a 13% rise in mental health conditions in the last decades. And so, looking at all of this, where does the services, where do we look at companies trying to fill in the gaps using technology, using innovation? I think this one's pretty cool. An online service out of the UK, it's not American yet, but hope to see actually some of these insurance companies not just sitting there finding ways to cherry pick money out of our system, but to actually come out with some of this stuff. And this is a little bit, I think, even farther ahead of what we're seeing a lot here. Maybe Humana and some of these guys are going to have similar things, but again, it's still too kind of a rat race right now in our healthcare sector to get fully dialed in on what's going to be. But anyways, talking about this, so Bupa. This is an extension of Blua, which is a health insurance, and Bupa Health Insurance. It's this whole thing in the UK, but it's pretty cool because, again, they're trying to do personalized care within the insurance, and I think it's something I absolutely support. So, looking at this, 2 seconds. A Blua solution, guys. A digital health solution that offers services to their insurance customers in a smart, seamless, frictionless way. Innovations in technology are evolving the future of digital healthcare. Blue builds on this by guiding and supporting their customers through their health journey with personalized and high-quality digital healthcare experiences. What are the key features? Virtual consultations, health programs, and remote healthcare. But pretty cool. So virtual appointments, 24/7 access to the doctors, and this is through your insurance plan. So this is pretty nice. Remote monitoring, checking blood pressure, respiratory rates using whatever they've got their AI, trackers of that. Ambulance tracker, if you need it. This is again the UK, but still pretty cool health programs to support back pain, tailoring exercise for stuff like that. Mental health support. Again, as we're talking today is Blue. Excuse me. Let me finish my word. Blue Monday. The most depressing day of the year. So, talking about this Blua and this is just pretty cool because, mental health support via all of your one-stop shop insurance plan. I know you don't see dental care, but, really where you have something like this is an all in-house thing where you can actually, help diagnosing conditions and physiotherapy, really helping support people's chronic pain, some of the initial foundations of what those things might be causing that, aka mental health and trauma and things like that, on top of the virtual consultations, which help improve some healthcare access when you really think about that, because all the coordination it takes to go to those appointments, to get there, especially when your healthcare, may be a little bit more difficult to manage, right? And So getting that healthcare to come to you and making sure your doctor has all the data points to properly, diagnose you, gets you to a really good spot. I know, again, a manual palpitation with a hand, and those doctors, there's always going to be something to that and being able to see somebody. But again, you're going to be able to eventually, probably sooner than we think, get hologram pictures of both hologram, content of you and your patient kind of interacting with each other. Maybe the full palpitation is not going to be quite there, but on top of the other AI kind of analysis and scanning that you can do of the body, and that these things are going to superly fast start picking up on. I think this is awesome. But an insurance company that developed a technology that's an in-house thing, this makes me salivate for sure. So this is the kind of thing that we're working on at Farm True in a different way. When you're blending pharmacy, cannabis, personalized medicine, it all starts becoming the same thing, and these guys understand that. So shout out to this kind of thing. This is a MLK, I think, aligned technology here in 2024. All right, so this one pretty interesting. I want to share it with you guys for our Enlightenment Hour. Anybody who cares to kind of cruise through this is not everything that I have full-on experience in, but for men and women out there, I think this is something that's cool. And people that do see some of those things like wine and paint and things like that. This is one of those things. Art therapy can ease the transition through menopause. We literally study it. Art therapy has the potential to help women deal with menopause. A new study reports creative arts therapies combined with nutrition education significantly improved quality of life, stress, anxiety, and body image in a group of overweight women who had entered menopause, researchers said. All participants who also experienced decreases in body mass index and blood pressure. And we learned that the participants, being a part of relatively understudied and neglected population, women who are overweight and in the post-menopause stage of life, appreciated having a special time and space set apart for them that permitted mindful art, writing, and movement experiences, said lead researcher Rebecca Dietrich Hartwell, research fellow at the Drexel College of Nursing and Health Professions. So, the tiny study, 3 women attended a 16-week online interventions, weekly sessions facilitated by a nutritionist, a dance movement therapist, and an art therapist. The art therapy sessions focused on quality of life, emotional regulation, body image, and stress management. For example, participants were asked to depict the transition from a negative to a positive emotion. One woman started with a red angry swirl of oil pastels on one side of a piece of paper and a blue boxy structure with circles inside representing contentment. She connected the two sides with a purple rainbow. Nutrition education included topics like choosing healthy food and beverages, managing portion sizes, and staying hydrated. The results suggest that an integrated approach can help women with menopause deal with physical and emotional challenges that come with that stage of life. So, while this is a very small sample and findings cannot be generalized, again, a study that came out today, they indicate a multimodal intervention with educational, expressive, and creative components can be beneficial for physiological and psychosocial well-being of postmenopausal women who have an elevated BMI and at risk for cardiovascular disease. So, Valentine's Day, take your lady out for a wine and paint, right? Sponsor one of those creative moments out there. Get into guys too, right? Not necessarily, I know this article kind of showed a little bit of guys or women in a specific niche kind of thing, but there's just probably something to creative expression, right? As we talked about mindfulness and all those other things. So, all right, let's move on. Herbal Wellness Corner. So, surprising thing here, New Mexico lawmakers looking to tighten up laws surrounding cannabis. So, looking here in the state of New Mexico, cannabis, some important things that are kind of along the way. Tax increases here in the summer for not only patients, but for businesses, which we're hoping that do not get pushed forward. But another one here, kind of an interesting thing, you know, a couple takes on it. Let's just show you guys.
Recreational cannabis sales began in New Mexico. Lawmakers are taking a second look at what they want to tweak with the laws surrounding the drug. News 13's Natalie Wattis spoke with the state senator behind the push.
Now that we've had a couple of years to see how recreational cannabis is working in New Mexico, we now know where we need to, because we have the benefit of that bug testing.
In a mammoth bill from the Albuquerque Democrat, Katie Duhigg is looking to tighten up the laws surrounding legal cannabis in the state.
This is looking to make adjustments based on the kind of the lived experience of folks in the industry in New Mexico.
Duhigg says a lot of what her bill is doing is addressing the illegal market for cannabis, which she says is thriving in New Mexico because of the plant coming in from surrounding states.
We are looking to tamp down on that illegal market so that the folks who are here participating and following all the rules aren't disadvantaged for doing so.
Principally by creating a definition for what illegal cannabis is under the law and increasing penalties for people trafficking it.
We're increasing the penalties so that folks who are repeat offenders have a more severe consequence.
The bill also gives the Cannabis Control Division the power to seize any illegal cannabis they come across during their investigations.
Because right now, if they find some illegal products and they don't have the ability to seize or embargo them, those products get right into the black market before CCD can really do anything about it.
Duhigg is also trying to loosen the restriction on licensing, allowing people to have both a cannabis and liquor license, which they currently can't under the law.
So we're fixing that here, and we're saying you can have both licenses, but you still can't serve them together because it's just too much of a public safety risk to do so.
Even though this is a short session, Duhigg is optimistic about this bill.
This is still a really important issue because there's a lot of people in New Mexico now who this is how they're making a living. And we want to make sure that they can continue to do so.
Natalie Wattis, KRQE News 13.
Other provisions in the bill include restrictions on package advertising to not appeal to children, like changes in banning cartoon images.
So, I mean, thoughts from that, guys? I mean, truly, my questions are, well, okay, number one, when you say the alcohol and cannabis thing, they cannot be served together. What entirely does that mean? Cannabis consumption or cannabis retail sales? When you say the word serve, I'm thinking cannabis consumption lounges and bars or restaurants that serve alcohol cannot be, you know, together. I wouldn't think that, I don't think you're serving alcohol if you're selling it, you know, by the bottle, unless it's defined as serve that way. So that's questionable. If, you know, what does that entirely mean? Because that would be, I mean, kind of limiting them being consumed together doesn't, I mean, I'm against it. I think that's silly. But I mean, at the same time, I see the slower methodology and approach, you know, at least be a little bit more cautious on that. And if that's what the laws are going to evolve into, it's only been, 2 years to get to this point. So it's not that bad. I'm sure at someday you're going to see a world where alcohol and cannabis can be consumed in whatever place that, right, within whatever reason that that together and sold together, right, without issues. And I don't know, it's going to take some time. So, I mean, anywhere you would imagine cigarettes, e-cigs allowed, cannabis should be definitely, you know, at least considered possibly allowed depending on property owner and that whole situation. So, you know, again, that's personal opinion, subject to my own opinions as well. But, you know, things I definitely do not support any more taxation here in the state of New Mexico, regardless of how successful the state has been in cannabis sales. You know, it hurts everybody at this point. We are paying a significant amount of taxes and state fees as is. And, you know, if that's not getting spent appropriately at this point, like, we got other issues. And right, I think, you know, if we can get to a good point of, you know, regulating cannabis industry here and setting a good example for the rest of the country, those are all good, positive things that come out of our industry. Perhaps even in 2024, there's still so much there to learn. But again, interesting, you know, possibilities that could be on the forefront there. She's saying there the black market, 1/3 of New Mexico's sales are going to the black market. So that is a big stat there. I'm curious how exactly that gets devised. But again, you don't want people crossing state lines and moving stuff in and putting those out for sale against everything that's out there, or slipping them in and trying to think that's okay, and things like that are not cool. So, again, it just hurts, good people trying to do good business here in the state that are from here that, try to actually or do good things. And, plenty of people are doing good things, figuring it out, but it's still hard to get buy-in. Again, in an industry where there's truly, right, like no recipe on how to do it. I mean, it's one of those that you have to be very careful. And just like anything else, if you're in business and whatever you do in life, I mean, you got to be careful. You got to have a plan. You got to do what you got to do. And so, I mean, either way, what do we want the cannabis industry to be, right? And I think obviously that's a question I think about day in, day out, each and every single day, and something I envision a great world, where healthcare is going to, be elevated by cannabis being, alongside a team of personalized care and personalized medicine, with holistic healthcare that, really does start substituting out some of these bad medications, Beer's criteria, benzodiazepines, opioids, the opioid epidemic, of course. Imagine a day when that thing is cured. We're only going to hit it if we, keep pushing that way. And we have pain receptors, opioid receptors and cannabis receptors along all those pain pathways right next to each other on those pain receptors. And, finding a way to take down our opioid dose, where America is consuming 80% of the world's opioid supply, being only 5% of the world's population, guys. If we can actually find a way to get that taken down and figured out to get it, to a reasonable number there, where we didn't just, somehow, mind warp ourselves into being completely addicted to opioids, that, find a way to get some hope and healing out of that. Cannabis is one of those things that really can do it in a very, very safe manner when done properly, appropriately, and personalized, right? And that's something that we still have to figure out how to get everybody on board with and create good systems to pave the way there to help people, right? And that's something Dr. Martin Luther King there, I think, would definitely support, and having the courage to speak up about that, guys, is something that we're doing not just today, but each and every single day, guys. Again, ultimate measure of a man is not where he stands in a moment of comfort and convenience, but where he stands in a time of challenge and controversy. And cannabis systemically has had very similar issues and injustices that, minorities have had all over our country, right? And those things that we can say. And again, cannabis is a medicine in relationship to what we can truly do and potential when we're looking at cancer therapy, opioid therapy, epilepsy, autism, really making a difference there. And, some of these high dollar meds that we are sitting there developing and selling and doing, and we're not giving our research and the testimony to what cannabis could be, because we've outbanned it for years, plus 100, 1912, El Paso, Texas, first place in America to get banned, right, prohibited from using cannabis. And here we are today. And it just, that's my rant. So a big one, I think Dr. Martin Luther King Jr., maybe he wasn't personally a cannabis consumer, but I think if educated and understandingly would get the message. I think we do have a lot of standout American, presidents and things that did use cannabis as well back in the day, but we're not getting into that today. Today's Dr. MLK Day. So, in again aligning to this, what we're looking at, guys, look in our community spotlight, Dr. MLK Day. I want to shout out a local group, Doña County Champions of Resilience, Doña County Resilience Leaders. Their mission is to prevent adverse childhood experiences, family trauma, and social adversity by working to ensure all county residents have access to 10 vital services for surviving and thriving. So, pretty cool stuff that's here in our region, in our area. Something I think, definitely in our community that aligns with MLK and his vision and things that he's doing. So, looking at the 10 surviving and thriving sectors, guys, you can look at all this stuff. And again, mental health care, dental care, behavioral health, food, housing, transportation. You're looking at all this parent support, early childhood learning, community schools, youth mentors, and job training. It really, you start taking a village to make sure your community has the support to really survive and thrive. And, again, this is the kind of stuff that fixes the injustices of pharmacy deserts and things. But pharmacy deserts do not make, the case any easier at all and things like that when you're fighting against big corporate, values and things like that. And it's Cassandra Gondor. She's awesome. And shout out to her here and her mission and everything.
Resilience leaders consist of...
If this is a YouTube video, it's going to shut me down for trying to play it. So I am going to just leave it for now. You know what? No, we'll play it.
Of representatives from over 50 agencies that provide services to county residents.
The Resilience Leaders are a group of people in Doña Ana County who are committed to combating adverse childhood experiences. So really looking at child maltreatment from a preventive point of view. As communities, we want to make sure that we're not addressing childhood maltreatment and neglect only after it happens. We want to take a preventive lens and really integrate that perspective into the fabric of our communities and the way that our communities do services.
Their mission is really to connect so many partners in the community with the Anna Age 8 book that really talks about the CYFD system, taking care of our youth in our community and how the system unfortunately is broken. And so how do we protect our moms, our dads, our children within our community?
So ultimately, the goal of the Resilience Leaders is to reduce these barriers to accessing services and thereby reduce or eliminate adverse childhood experiences in our population.
Our mission is to prevent adverse childhood experiences, family trauma, and social adversity. I believe we all have a role to play. Resilience Leaders provides that seat at the table that's so crucial to ensuring our children and families flourish.
So, shout out to a awesome local group there in our community spotlight, brought to you by the Big Chicken Farm. Cool stuff. Last thing, guys, close you up on our Men's Health Minute, MLK Day. Thanks for anybody who's hung in there with me. Hope you guys are getting some value out of this. Thank you, Miss Zubia. You're awesome. Appreciate that. All right, guys. So closing up Men's Health Minute, unpacking, the societal pressures on men and taking a little look at this one. So, again, what are some of the perceptions of society on men? Men have always been the superior species in society. Even until now, where feminism is strongly upheld, society has exceptional assumptions on them. People tend to forget the fact that men can also be victims of prejudice and stereotyping. Again, and this is not to polarize women or anything like that. This is just, an independent thought for men. And it is, feel free to share it with me. Pressures of society on men are filled with expectations and demands that can be quite challenging and stressful. Even if there's a huge change in gender roles today, men still need to constantly prove their masculinity because of the strict and rigid instructions while growing up. Perceptions of society on men include, when men behave outside of their traditional roles, society penalizes them and typecasts as irresponsible and weak. They should be the ones to provide and protect. It's not easy to reverse the perceptions of society on men because we are attuned to the notion that men should be strong and bold. Men should be the family breadwinner. Studies showed that 76% of men feel pressured in providing and supporting their families financially. This leads men to intensely focus their lives on how to earn money. Their perception of society is for them to be the main breadwinners in the household. They need to make sure that their families are living comfortably. Even before marriage, men should be the ones to pay for dates or buy flowers. If they fail to do this, they are branded as unromantic and rude. Though this is not always the case, many women still enjoy and appreciate these gestures from men. Aside from providing for the family, they also need to be good role models to their children, other young men. Men cannot be victims to sexual harassment, right? When it comes to rape and sexual harassment, men are always seen as the perpetrators and never the victims. Since men are supposed to be physically strong, they can easily defend themselves. They can fight their way out whenever someone attacks them, theoretically. Based on several surveys, 1 out of 10 rape victims are male. For some, it is hard to believe that men can be victims of rape, especially when it is done by a female. Men are supposed to be brave and strong. Just hard to accept that men can be also vulnerable and defenseless. And then again, this is still an independent thought there, and this is not to have any sort of discussion on rape, but yes, it's a good point there. Masculinity is not bad. What's bad is toxic masculinity, right? That can be harmful and it can lead to toxic behaviors. And maybe, some of it you can, tap into, but things, at the end of the day, thoughts become actions lead to outcomes. And again, those things that, can be labeled in those categories can definitely, lead to different outcomes that men have obviously probably had in more of a pattern of behavior over time. So again, men should not be sensitive and emotional. Another perception of men. We hear the phrase over, be a man, don't cry. This is one reason why men now choose to suppress their emotions, because they don't want to be discriminated against or mocked. One common perception is that they should not be emotional, steering them towards a path of aggression and violence. Instead of taking their feelings out, they resort to abusing their partners, drinking alcohol, or taking drugs. Also a reason why society only frowns upon men who make love, makeups, or fashion. Men only want sex. Another misconception of society on men is that they always want sex. Men enter relationships because they are after sex. They want to feed their lusts and promiscuity. This notion views men as incapable of falling in love. When men have numerous girlfriends, they are labeled as playboys and immature. And when men also choose to be in relationships because they are incapable of connecting and loving someone, when it comes to having an intimate relationship with someone, men are expected to take control and to initiate romantic gestures. It is not true that it is all about sex. There are actually many men who give more importance to having a serious and deep relationship rather than having flings. Another one. Men have strong mental health. Society has this hold on men that they will never succumb to depression and anxiety. They have strong mental health and do not break down to problems easily. Sad to say, men are as susceptible to mental health awareness issues as women. Mental health problems do not stereotype against gender. Many find it strange when men attend therapy for any reason, right? Or counseling sessions. And because society has the pressure on men to be strong in all aspects, it can be difficult to face the truth that men sometimes may need also medical help from therapists, psychologists, or right, other people to be able to talk things out and to think things out. And so, where you come out to some of these things, does it become maybe a mindset shift and ownership of your own life and what's in front of you, and painting your perceptions? Absolutely sure does, and sure is an accountability there. But also something not to forget at the end of the day, that we've transformed and misconstrued maybe some of these gender roles, now that we're in 2024 or whatever they are. But again, for men that are just trying to get back at things, it's just kind of my thing to say, it's okay to understand that some of that is challenging. It's hard to meet some of these societal expectations all the time, and maybe getting that thought process of where if you feel your perception could be off of whatever it is, how can you address it and then still keep yourself healthy and do good things. I hope to help you out with that in this show, help increase access to care and medicine for all of our viewers, men or women for sure. But one of those things in our Men's Health Minute, where you think those expectations that we have put on ourselves in society, have put on men, has created a little bit of some of these behaviors that are counteracting ourselves. And again, same goes for men's expectations on women and things like that. All of these things can be misconstrued, and obviously individuality, the freedom of independent thought, and being your own person and making your own decisions, and really looking in that, doing that inner work, is just one of those things that I think just mainstream takes away from us just by being just so much, right? And wherever that is, if somebody actually wants to start getting right and thinking about that, that's again something to encourage and something to empower, and realizing that maybe you have to rework the reasons why in your mind that this has created maybe you to get behind a couple steps on where you want to be in your own health, or something, right? Finances, or whatever people manage and do, right? Business, you can school, whatever goals you might think in your life. And these are men and women. There's still problems for men and women, but looking at that, it's okay to just kind of realize that all of it is a part of maybe something that you've kind of been slightly wired to be through that, right? And just acknowledging it, use it as something to be even better in and to acknowledge. So guys, MLK Day. Hope everybody had a good one, and we'll see